How you doing? My name is Lashara Allen. I have chose two articles about strokes. Stroke in pregnancy, clinical presentation, evaluation, treatment, and epidemiology. Soda consumption, and the risk of stroke in men and women. The etiology of stroke is blood flow is interrupted in the brain. Ischemic stroke occurs when the blood flow to the brain is impaired and tissues die. Cause of ischemic stroke are embolisms, thrombi, and hypotension. Hemorrhagic strokes occur when blood vessels rupture and tissues is damaged, resulting in the spread of blood into the brain. Factors contributing to hemorrhagic strokes include hypertension, pressure, edema, and hemorrhaging to the brain. Transient ischemia strokes, also known as a mini stroke, could be caused by a temporary clot that resolves within minutes to hours, no longer than 24 hours. Symptoms of stroke include numbness, difficulty walking, talking, poor coordination, blurred vision, headaches, and seizures. Stroke in pregnancy, clinical presentation, evaluation, treatment, and epidemiology article has also added to many pregnant women suffer from hypertension in pregnancy and can be pre-existing, gestational, and secondary to preeclampsia and eclampsia. Another source that I read, verywellhealth.com, the author Jose Vega, MD, women who have blood clotting problems, autoimmune disease, and high blood pressure or heart disease have a higher risk of stroke, particularly during pregnancy and at the end of the postpartum period. In agreement, other risk factors associated with pregnancy related to strokes include hypertension, diabetes, vascular heart disease, and hypercoagulable disorders. Even abuse of tobacco and other substances. Complication of pregnancy, labor, and delivery has also been associated with the risk of stroke, including anemia, thrombocythemia, postpartum hemorrhaging, transfusion, and electrolytes and acid-base disorders. The other article, soda consumption and the risk of stroke in men and women. Soda contains a high amount of sugar, artificial flavors, and dyes. Dark sodas are also considered to be the worst out of all sodas, increase heart disease and diabetes, and it also contains no essential minerals or vitamins. Healthline.com author Joe Leach, MS, states it is very well established that sugar-sweetened drinks increase the risk factors for heart disease, including high blood pressure, blood triglycerides, and small dense LDL particles. In agreement, soda can be linked to strokes. Soda can increase the risk of diabetes, blood pressure, and heart rates. According to WebMD, treatments for strokes consist of blood thinners, medications, TPAs. Medication also listed as anticoagulants, statin, and antihypertensive drugs. Supportive care will be a cardiac monitor, surgery, carotid endarterectomy, therapies that will also help anyone who suffered from a stroke will be speech therapy, rehabilitation, occupational therapy, physical therapy, and stroke rehabilitation. Preventive methods will be quit smoking, exercise, drink as much water as possible, and of course, cut down on the soda and change of diet. And that is it. My references are WebMD, Very Well Health, Healthline.com, Stroke and Pregnancy Clinical Presentation, Evaluation, Treatments, and Epidemiology, Soda Consumption and the Risk of Stroke in Men and Women, and together we can all prevent strokes.